Dr. Petti, why do wisdom teeth or pulling a wisdom teeth, why is there so much pain around it? I mean, it's just, people just talking about wisdom tooth. I think it's worse than a root canal for most people. What is it about wisdom teeth? Why are they there? What's going on? And is it really such a drama? Shed some light on it.
As far as wisdom teeth themselves, Helmut, they have kind of lost their usefulness over a period of time, meaning many, many, many moons and years ago, in primitive man's diet, they would kick in and they would be fine because the teeth would naturally have a more coarse diet and they would wear more, and thus when the wisdom teeth came in, there would be room for them. So over the process of evolution, they've kind of lost their
use.
Use and purpose in there. So wisdom teeth still do develop, and when they try to come up through, a lot of times there's just not enough room for them to come in, or they'll come in halfway in and cause a lot of irritation. So that's where we're at as far as the history of wisdom teeth.
Okay. So what about the procedure of getting rid of them? Because that's which people connect with an awful lot of pain and misery.
Right.
And literally because of it, many young people don't do it and then do it at an elder age when it is apparently even worse.
Right. As far as extraction or getting rid of wisdom teeth, as we would want to say, the younger the one can do it, the better off they are. In my practice, what we do is we keep tabs of what is going on with the wisdom teeth as they're developing and coming up through. If they develop and come up through, you want to give them every chance in the world for them to come in and bite and function just like normal, the other teeth would. So we're not in any rush to see if we can get them out yesterday. However, when the kids are in their later teen years, and once the teeth are developed, then if they're there and bothering people and coming through and you know that there's not enough room, time to get them out. As far as difficulty in taking them out, every person is different. And every situation with every wisdom tooth is different. Top wisdom teeth usually, and let's underscore the word usually, have more of a conical or ice cream cone shape to them. So when they start to come through, a lot of times if they're through the tissue and the dentist can see them, they are some of the easiest teeth and easiest extractions to take out. Bottom wisdom teeth can be the same. They can have roots that are conical, but they can also have the multi-rooted structure in there that kind of wraps around the jawbone. So once again, if they're through and the patient's younger, easier to take them out. Obviously, if wisdom teeth are lodged below the jawbone, they will become more difficult to take out. But with today's techniques, either the dentist and or the oral surgeon totally versed on how to get them out with the least amount of problems in there. And it doesn't have to be an arduous, uncomfortable, long healing procedure in there.
So maybe new medicines or whatever it is, whatever it might be, that the after effect, because that's what people so much worried. It's like you're going to be for a week out of commission. Is that still true or not really?
In most cases, no. I have seen very few people out of commission for a week. Can a person be sore? Absolutely. All right. But once again, in the proper hands, with today's medications, people are so-called back to battery in pretty much no time. I've had patients in my office who we've taken them out one evening, and the next day they're absolutely back to work. So once again, each case is individualized in there, so the patient getting the proper information, getting the proper treatment, having the proper person do them under the right circumstances. Wisdom teeth can be they don't have to be a big ordeal. Not at all.
Again, good news from a dental office. Thank you very much, Dr. Petti.
Okay, thanks, Helmut.